So this short clip is going to talk briefly about when someone should consider taking psychiatric medications and when one does not. And I just want to start out by saying there's a difference between feeling depressed and clinical depression. There's a difference between anxiety and having clinical anxiety. So clinical anxiety is when it affects your work, your school, or your relationships. And when it affects that part of your life, it really needs to get addressed through therapy or medications or a combination of things. So for the most part, and for most mental health conditions, therapy can be sufficient to help one redirect their thoughts, their feelings, their actions, and they may not need medications at all. In fact, for people who are religious, like they talk to a rabbi or a priest, those can be sufficient substitutes for therapy if someone has access and able to meet with them consistently enough or to help them through their struggles. If this is a first-time episode of mental health problems, one could really consider checking with their primary care doctor, checking out medical causes, or ruling out medical causes that could be contributing. For example, anemia can lead to anxiety. Thyroid problems can lead to depression or anxiety. Low testosterone can lead to fatigue, mood problems, and so forth. When does one need to really consider psychiatric medications to address their symptoms? Well, if somebody is having a difficult time redirecting or controlling their thoughts and their life is being negatively impacted, then really highly consider taking the medications. Medications will help to calm down one's thoughts and mind so that they can have more control, can be better able to redirect their thoughts, and their emotions and their behaviors will follow. Conversely, if someone does not have the time or the patience or the resources to engage in weekly therapy or every few weeks, then one may prefer medications over the other. But oftentimes, for many mental health conditions, the combination of medications and therapy is the most effective treatment.